This is Muscular Dystrophy by Shafer for EXS486. Alright, so for the order of the presentation, we're going to do background information, symptoms, types of the disease, causes of the disease, the progression and advancement of it, research into the disease, diagnosis, treatment, exercise prescription, and then a conclusion. So what is muscular dystrophy? It is a group of diseases that causes progressive muscle weakness and loss of muscle mass. In this disease, abnormal genes or mutations interfere with the production of proteins needed to form healthy muscle, according to the Mayo Clinic. Okay, so is there a cure for muscular dystrophy? Sadly, there is not. But medications and therapy can be used to help manage and slow the course of the disease. Some people who have muscular dystrophy will eventually lose the ability to walk. Some may have trouble breathing or swallowing due to deterioration of the diaphragm and breathing muscles. So, some symptoms of muscular dystrophy: muscular atrophy or wasting away of the muscles. Frequent falls can be a sign of a progression or onset of muscular dystrophy. Difficulty getting up from a lying or sitting position, trouble running and jumping, waddling gait, walking on the toes, large calf muscles, which is contrary to what you might think with muscular atrophy, muscle pain and stiffness, learning disabilities, pain in the muscles, and many more symptoms that can vary case to case and version or type of disease, two types of the disease. So the first type that we are talking about here is Duchenne muscular dystrophy. This type of the disease is an inherited form of muscular weakness that gets progressively worse as the muscles get weaker and can become quite debilitating to the sufferer. This variation is most common among boys. It's very rare though, with less than 200,000 cases per year, which sounds like a lot, but with 9 billion people in the world, not that many. Symptoms and signs typically appear between ages 2 and 3, and about 1/3 of boys with Duchenne muscular dystrophy don't have a family history of the disease, possibly because the gene involved may be subject to sudden abnormal change or spontaneous mutation either in the womb or as they're developing between ages 2 and 3. So this is Becker muscular dystrophy. Becker MD has the same signs and symptoms as Duchenne, but they typically are milder, progress slowly, and they don't appear until later on in life. Symptoms generally begin in the teens, but may not occur until the mid-20s, or even later in some very rare cases. So this is the one that you would rather have, since it does appear later in life and is usually mild and it progresses slowly. There are lots of other types of MD. Some of them are myotonic, also known as Stein's disease. This form is characterized by an inability to relax the muscles at will following any contractions. There's FSHD, muscle weakness, typically begins in the face and shoulders. The shoulder blades may stick out like wings, called scapular winging, when they raise their arms. Congenital, this type affects boys and girls and is apparent at birth or before age 2. Limb girdle, hip and shoulder muscles are usually first affected, and people with this type of muscular dystrophy may have difficulty lifting the front part of the foot and may trip or fall frequently. So the causes. Duchenne muscular dystrophy is an excellent inherited neuromuscular disorder due to mutations in the dystrophin gene, according to a study by Falzarano et al. In 2015. Although all types of MD have their own specific genes that cause them, they're all caused by a genetic mutation or mistranslation. So all of them are caused by a genetic mutation. Many of these mutations are inherited, but some can occur spontaneously, either in the womb or throughout life, such as is apparent with Becker and Duchenne. The progression complications that can occur with this disease, many things can happen throughout the life of a person with MD. Some of these complications can arise from the progression are quite serious and very debilitating for a person's independence. Inability to walk being number one that we see. Shortening of muscles or tendons around the joints can also be a problem. Lack of flexibility, easily torn muscles and ligaments. Breathing problems, atrophy of the diaphragm and breathing muscles, unnaturally curved spines, scoliosis, kyphosis, etc. Heart problems, since the heart is a muscle, cardiac muscle can atrophy from this. Swallowing problems with the sphincters and motor control of the throat muscles can occur as well. So testing and diagnosis of this, there's a lot of different ways to test since there are different forms of it. Enzyme tests are one of the number one. Damaged muscles release enzymes such as creatine kinase in elevated levels will let a doctor know that muscular dystrophy is a possibility for diagnosis there. Electromyography, an electrode needle is inserted into the muscle to be tested, and electrical activity is measured at the patient as the patient controls and relaxes the muscle. Genetic testing can also be done to look for mutations in genes that predict muscular dystrophy onset. Heart monitoring tests are common for those who suspected of having myotonic dystrophy. Diagnosis can vary from one type and test to another, and the call is obviously always up to the doctor to make. So for treatment, sadly, there is no cure, like we previously mentioned, for muscular dystrophy. Treatment can help prevent or reduce problems in the joints and spine and allow people with muscular dystrophy to remain mobile as long as possible and lead a very independent life. This can help someone remain independent longer, have a higher quality of life for longer, and essentially delay the inevitable. Corticosteroids, such as prednisone, can help improve muscular strength and delay the progression of wasting/atrophy. Therapies such as stretching and exercising can help maintain mobility of the joints and surrounding tissues as well. When looking at the research to answer the question, is exercise advised for someone with MD? It's a resounding yes. In people with FSHD, muscular dystrophy, regular endurance training improves fitness, walking speed, and self-assessed health in patients with FSHD without causing muscle damage, according to a study. And in limb-girdle MD, resistance training can be considered part of the rehabilitation program for patients with limb-girdle type of MD, according to another study. So for my case study, I did a fellow named James. James is a 5'8" and 157-pound 19-year-old male. He has a long history of progressive muscle weakening. In his first years of life, James reached many gross motor skill milestones, such as holding his head up, rolling over, sitting, and standing at normal times. However, he did not walk until age 16 months, and by age 2, started to assume a lordotic posture while standing, but not while sitting. Over the next several years, he suffered progressive muscle weakness, most notably in the proximal musculature of the arms, pelvis, and legs. Throughout the years, James has had no history of muscle pain or spasm, chest pain, or irregular heartbeat. He was diagnosed with a learning disability in the 4th grade, but has progressed through the grades with tutorial assistance. The only medications that he normally takes are calcium and fluoride supplements, and James has a younger sister in good health. No other immediate or distant family members have musculoskeletal difficulties. So stratifying his risk. He's 19 years old, 5'8", and 157 pounds with a BMI of 23.9, which is normal. His blood pressure is normal as well, 114/73. He's a non-smoker, has no family history. His cholesterol is 163 milligrams per deciliter, no medications, and he doesn't have an exercise history though. The patient's risk stratification would be moderate because they are symptomatic of muscular dystrophy and have been diagnosed, but have no other negative risk factors. For the exercise testing, I would do a graded treadmill test as well as a maximal exercise test to gauge ischemia. The exercise prescription: cardiovascular exercise via stationary bicycle. The frequency is 3 non-consecutive days per week. The duration is 3 30-minute bouts. The intensity is 50 to 65% of a VO2 max, and discontinue if there are any contraindications. More exercise prescription, resistance training. For the upper body specifically, since the lower body will be getting lots of work from the stationary bike as we increase the resistance on it, as well as the VO2 max. So for the upper body, 3 non-consecutive days per week as well, light to moderate with an RPE of 6 to 13, depending on how he feels that day. We're going to use some auto regulation since he does suffer from a progressive muscle disease. So both types, free weight and machines, are to be utilized with an emphasis on the eccentric portion of the movement to help facilitate neuromuscular control. 2 sets of 8 to 12 repetitions per set per exercise, and obviously we're going to discontinue if any contraindications arise. So flexibility, whole body, especially hip and shoulder joints, So the type is passive and active, as well as muscular activation and neuromuscular connection or mind-muscle connection work. Frequency, once again, 3 non-consecutive days per week. Duration, as long as they need to get through the stretching protocol, so we're going to hold each stretch for 60 to 120 seconds, depending on comfort levels, and progressively getting longer with the stretches. So however long they need that is how long it's going to take. Intensity is until slight discomfort in the target muscle/joint being stretched, but not until pain. And obviously, once again, discontinue if any contraindications arise. So, in conclusion, muscular dystrophy, or MD, is a somewhat rare but very serious and very debilitating genetic disease which progressively gets worse through an individual's life cycle. The 2 most common forms of it are Duchenne and Becker, with Duchenne being the more severe of the 2, along with an earlier onset of 2-3 years old versus teens to 20s. It is not curable, but we can delay it and improve quality of life and keep those suffering from the condition independent for longer through the use of therapy, flexibility, and using exercise as medicine as exercise specialists. Okay, so my references. I got a lot of the background information from the Mayo Clinic, so I have that referenced here. Most of the background information did come from them. I got the outline for my case study for James from the McGraw-Hill Company in their case studies in anatomy and physiology, focusing on muscular dystrophy. My 3 other studies that I cited, mainly for the use of exercise prescription in those with MD, are also cited here from an Italian university and 2 other ones.